The accomplishments of the Provincial Health Office for 2020. COVID-19 response. Since the discovery of the novel coronavirus in December 11, 2019, the world has been on its knees. In spite of what seemed to be insurmountable challenges due to the pandemic, the Provincial Health Office has relentlessly been providing essential health services to the people of Misamis Oriental. In preparation of the possible surge of patients in Misamis Oriental, last January 15, 2020, the Provincial Health Office conducted an orientation with the municipal health officers for the reactivation of the Barangay Health Emergency Response Teams, which is headed by the barangay captains. In that same month, other orientations were done by the PHO, including the 8 Miss or provincial hospitals and other partner hospitals of the LGU. By January 31, 2020, the Health Emergency Surveillance and Response Teams were reactivated. The Epidemiology and Surveillance Team of the PHO, headed by Mr. Aldo Obenza, prepared to commence in monitoring the cases of COVID-19 in the province. By March 12, the same team conducted several trainings for all the Miss or provincial hospitals on donning and duffing and other procedures in preparation for COVID-19 surge. In February 3, 2020, interagency coordination meeting was conducted with the Misamis Oriental Police Office, PDRRMO, PHO, PIO, PSWD, and other agencies. Hence, the Executive Order GYVBE number 2020-001 was signed and sent immediately to all the municipalities and was adopted. Several meetings were conducted with the different provincial LGUs to formulate travel regulations in Misamis Oriental based on the national IATF guidelines. In February 17, orientation on COVID-19 was done by Dr. Kalingasan to all capital employees during the flag raising ceremony. Updates have been given periodically since then. Also in February, there was a distribution of thermal guns to Kaap, Port of Cagayan de Oro, and the Port of Balingwan, Misamis Oriental. March 16, distributed and turned over personal protective equipment to the regional and provincial police forces during the flag raising ceremony. April 6, Executive Order GYVBE number 2020-010-A was issued imposing the mandatory wearing of face masks, be it homemade or improvised, in all public places. Meetings have been conducted regularly as needed. Other health programs. Expanded program on immunization. The PHO's coordinator on expanded program on immunization, Mrs. Maria Gina Abang, headed the implementation of the following immunization campaigns with the technical team of this office and the collaborative efforts of all 23 RHUs and 2 CHOs of Misamis Oriental. January 20 to February 2, monovalent oral polio vaccination round 2. With a target of 95%, the activity garnered an accomplishment rate of 98.13%, which meant that 104,430 children aged 0 to 59 months were vaccinated in the entire province out of 106,393. February 17 to March 1. Round 2 bivalent oral polio vaccination was conducted, still with the national target of 95%, achieved an accomplishment rate of 99.63%, having vaccinated 105,995 children aged 0 to 59 months out of 106,393. July 20 to August 3. Round 3 bivalent oral polio vaccination achieved a whopping accomplishment rate of 100.65%, having vaccinated 107,074 children aged 0 to 59 months out of 106,393. October 26 to November 25. Measles Rubella Supplemental Immunization Activity, or MRCIA. Still with a target of 95%, which is 82,258 children aged 9 to 59 months, for the 23 RHUs in 2 cities of Misamis Oriental has attained an accomplishment rate of 98.06%, having vaccinated 81,909 children. The success of all immunization campaigns is the result of the collaboration and cooperation of all RHUs and CHOs, especially the collective hard work of all barangay health workers. And with the full support of Governor Bambi Emano, more people have been convinced to have their children vaccinated.
Ang polio usa ka katakod nga sakit nga makuha gikan sa kagaw nga polio virus nga moresulta sa pagkaparalisa, bakuna lamang aron malikayan ang
measles, rubella ug ang cervical cancer nagsaka dinhi sa aton pulong. Dangog kamo sa pinakaduol nato nga mga health center sa inyong mga lugar. Kung nagahangyo, ako nagapangaluyo para sa hinsog makatawhan sa lalawigan sa Misamis Oriental ug nasod sa mga pagpunan.
With the official announcement last December 15, Misamis Oriental is ranked number 1 in the entire region. AOP. The Annual Operational Plan is the yearly translation of Plan for Consolidated Local Investment Plans for Health from all 23 municipalities and 2 cities of Misamis Oriental, which requires so much hard work and focus by our experts. AOP for 2021 was appraised by the PIDOHO, signed and approved by Governor Bambi Emano, and has been submitted to the regional and national offices of the Department of Health. The universal health care. With the government's mandate to ensure that every Filipino shall receive affordable and quality health benefits, the Universal Health Care Bill has been signed into a law, RA 11223. Misamis Oriental is one of the chosen integration sites in the country and will lead the region in addressing the inequities in the health system. Now and thereafter, every Misamisnon is ensured of financial risk protection and improved access to quality healthcare and facilities. This is all possible through the efforts and commitment of Governor Yevgeny Vicente Umano in his aim to alleviate the burden of Misamisnons of a fragmented healthcare system. Governor Bambi and UHC will leave no Misamisnon behind. Emerging and re-emerging infectious diseases and surveillance. The PHO was tasked to issue travel passes for all those who are required to cross the borders of Misamis Oriental. Risk assessment was prepared and formulated by Dr. Jerry P. Kalingasan, which categorizes a previous exposure as low to high risk. This form has been utilized by MHOs in the respective areas. Travel passes issued from April 13 to May 28, 17,414. As of December 11, risk assessments done, 445 patients, rapid antibody tests performed for COVID-19 suspects, 856, reverse transcriptase polymerase chain reaction or RT-PCR tests done, 177 patients. RT-PCR testing has been continuously conducted as needed. Bida Solusyon. The Bida Solusyon program aims to reinforce the society's behavior in combating COVID-19 with the following acronym. B. Bawal walang mask. I. Isanitize ang mga kamay. D. Dumistansya ng 1 metro. A. Aksyon base sa saktong impormasyon. October 5, Dr. Jerry Kalingasan signed an advisory that there should be an identified Bida Bastonero in every office under the LGU, including the barangay level, to ensure that the Bida actions are being followed. Successful visit of Dr. Beverly Hall, the Director of Health Promotion and Communication Services from the DOH Central Office last October 22, to talk to Dr. Kalingasan about Bida Solusyon and COVID-19 response of Misamis Oriental. Family planning. The National Objectives for Health gave a target of 29% for the contraceptive prevalence rate, or CPR. This is the percentage of women aged 15 to 49 years old, sexually active, who are using any method of contraception. In Misamis Oriental, we have achieved an amazing 40.31% CPR due to the concerted efforts from all stakeholders, especially the LGUs. Continuous FP service provision, including facility visitation, monitoring, and mentoring, have been continuously done amidst COVID-19 through the partnership of DOH, POPCOM, provincial, municipal, and city LGUs, Reach Health, and USAID. Family Planning Expanded Program on Immunization Integration is a pilot activity of the PHO, wherein the healthcare worker discusses family planning during visits for immunization. As such, were done during the measles rubella supplemental immunization activity. Adolescent Health and Youth Development Program. Total number of teenage mothers given antenatal care for the first 3 quarters of 2020 is 1,267. Total number of teenage pregnancies from January to September 2020 is 1,279. This figure is 9.78% lower than the pregnancy rate last 2019, which is 1,419. The PHO also facilitated the allocation of HPV vaccines and syringes, which was distributed among the municipalities of Misamis Oriental. This is in line with the human papillomavirus vaccination among female adolescents aged 9 to 14 years old, which started last September 2020. Total number of vaccines delivered, 47,961. Total number of female adolescents 9 to 14 years old who were given HPV vaccines, 3,760. Environmental Sanitation Program. The PHO has declared 61 barangays as zero open defecation, distributed 300 hand washing kits as augmentation to different barangay isolation units, conducted program implementation review via Zoom to 23 municipalities and 2 cities with Dr. Marieto Austin Paasa, Active Assistant, PHO. Filariasis, malaria. Total number of nocturnal blood examinations performed for the first quarter of 2020 was 1,412. Deformity monitoring has been continuously done. Prior to the pandemic, PHO has distributed 102 bales of long-lasting insecticide nets. Mental Health and Drug-Induced Psychosis Program. The program has continued to perform home visitations for violent or restless patients and information drive regarding mental health. From January to November, there has been 46 new mental health cases with 626 patients followed up, 2 new drug-induced psychosis patients, and 55 patients followed up. Oral Health Program. Basic oral health care, or BOHC, was provided to the people of Misamis Oriental from infants and pregnant women to senior citizens until March 2020. Some dental services have been stopped since the pandemic. During the pandemic, however, fluoride varnish has been distributed to parents for them to apply to their child after proper health education and was able to render services to a total of 12,786 patients. Animal bite services for anti-rabies. From January to December 10, 2020, there has been 1,287 patients for animal bites serviced by the Provincial Health Office, and education campaigns have also been continued all throughout the province. The laboratory services provided by the PHO are first, quality assurance validation such as TB microscopy having validated 417 slides and malaria microscopy validated 170 slides. Second, water analysis. Third, other DOH programs that utilize the laboratory services are filariasis elimination program, nocturnal blood examination, Manchin, such as blood typing, blood sugar testing, hepatitis B screening, syphilis screening, emerging and re-emerging infectious diseases like COVID-19 tests, like RDT and swab collection. HIV or Sexually Transmitted Infections Program conducted HIV 101 and community-based screening in Villanueva, Misamis Oriental, coordinated HIV activity in Mantico, Misamis Oriental. Leprosy Program admitted walk-in patients, case finding and case holding, provision of multi-drug therapy, skin consultation conducted at selected RHUs to find hidden cases of leprosy. Followed up patients' contacts for possible transmission of the disease, leprosy statistics, new cases 21, cured 12, ongoing treatment 49. National Voluntary Blood Services Program. Total number of blood bags collected 2,131. Number of facilities conducted bloodletting activity 11. Newborn screening. There has been a total of 5,740 newborn screenings done until the third quarter of 2020 for the entire province of Misamis Oriental. National Tuberculosis Program. TB team conducted counseling on TB in provincial jail, delivery of Gen X machine to Lagindingan RHU, and coordinated with the different TB DOTS facilities such as Lugait, Lagindingan, Tagalwan, and Magsaysay for the installation of machines given by PBSP and the DOH. Conducted rollout on 6th edition Manual of Operations on TB and attended regional program implementation review. Case detection rate of 36% with 1,554 patients, cure rate of 89% with 529 patients, treatment success rate of 98% with 1,808 patients. Nutrition Program. For breastfeeding, all 8 MIS or provincial hospitals have become DOH certified mother-baby friendly health facilities. That's 100%. Out of 8 bus terminals, 4 breastfeeding areas were installed. For Garantisadong Pambata campaign vitamin A supplementation, vitamin A capsules given out 85,000, calcium carbonate 3,696. For food supplementation, outpatient therapeutic care given to severely malnourished children 297, moderately malnourished 108. Dengue surveillance. Last year, reported number of cases were 4,993. This year, as of October 23, 2020, the count is only at 1,119 cases as the PHO continues to push cleanup drives on regular basis with emphasis on the 4 S's contra dengue within the municipalities and cities of Misamis Oriental.